The BOP actually defines this category as medically acceptable, not always necessary. This group includes conditions for which treatment may improve the inmate's quality of life. Example of treatments for this conditions in this category, as listed in the BOP policy for patient care, include joint replacements, reconstruction of the anterior cruciate ligament of the knee, and treatment of non-cancerous skin lesions. Such treatment procedures require review and approval by the institution's utilization review committee, which considers certain risk factors, including risk and benefits of the treatment available, resources, including costs, security, staffing, and transportation, the inmate patient's medical history, and how intervention, lack thereof, will impact the inmate's activities of daily living. Here, the next part, pay attention to, should an outside specialist consult be needed for a non-emergent condition, a referral request is made to the prison's utilization and review committee and clinical director. Other members involved in this decision-making process include the associate warden or warden, health service administrator assistant, the medical trip coordinator, and any healthcare providers directly involved in the referral, perhaps the director of nursing and the chaplain. The clinical director has the final say over all utilization review committee decisions. If approved, the inmate patient will be placed on a schedule or waitlisted until the specialist has an opening during the contract's limited monthly hours, which may be several months or years later. Notably, the clinical director is under no obligation to follow the medical recommendations made by the outside physician's consultant specialist. If the recommendations are not followed, the clinical director will document his or her justification in the inmate's health care record. Justification may be based on the category of care sought. Something to think about before you go in and have your physicians, if in fact this applies to you, address before the pre-sentence interview. Number 4, medically appropriate. Some treatments, even though recommended by a healthcare provider and deemed appropriate by the clinical director, still require approval by the utilization and review committee, which is not likely to be granted. These treatments are considered by the Federal Bureau of Prisons to have limited medical value and include cosmetic procedures and removal of non-cancerous lesions. It is worth noting that some lesions may be misdiagnosis, so the denial of treatment for these appropriate medical procedures should be of concern for inmates having such healthcare needs. Again, should you fall into this particular category, your physician and attorney needs to note this so that it makes it into your pre-sentence report. Otherwise, if you have what appears to be a skin lesion, they're going to say, no, we're not going to biopsy it. And so if you have a history of a skin lesion that's cancerous, that needs to be very clearly written, because that's going to, having that treated or biopsied and removed on the outside is considered standard of care in the community. Having that same